Enright?
Yeah.
Okay, 3, 2, 1.
Hello, I'm Kevin Enright, one of the consultants in emergency medicine and lead for service improvement in the emergency department. I'm going to talk to you a little bit about EDSIT, which is the Emergency Department Service Improvement Team. I chair EDSIT. Last year in the emergency department we decided to introduce service improvement initiatives, and at that time we had 10 work streams looking at 10 different aspects of how the department operates. One example of where our focus was at the time was the urgent care centre. So that was relatively new and allowed EDSIT an opportunity to put its imprint on a development within the department. As a result of this year we decided to formalise the process a little, so we created the Emergency Department Service Improvement Team. Now there are a number of aspects to EDSIT that are relatively unique and I think underpin its success. Firstly, it's multidiscipline, so by that I mean the involvement and committee members are doctors, nurses, managerial staff, admin staff, allied health professionals. And a second aspect is that we have junior doctor involvement, and that's relatively rare, and that's been quite an asset for the group. Another aspect to EDSIT's success, I think, is that it's work done within the department, by the department, and not outside. So the ideas are generated by those involved, and so they have a particular interest in seeing them be successful. I'm going to talk you through just some of the work we've done to give you a flavour of how service improvement can work within an emergency department. So one of the aspects we looked at was the discharge letters. So every patient that attends ED gets a discharge letter sent to their GP. Now this is really important from a governance point of view because it's the information the GP gets about the care their patient has received. And it also should have important information about what follow-up is required. When we did a detailed audit of this, we found that a significant number of these letters never made it to the GP. And of the letters that did get to the GP, the quality of information was very poor. As a result of this, we introduced a training program at induction for doctors to explain the importance of good quality information for the GPs. And at the same time, the Trust looked to moving away from posting discharge letters to sending them electronically. Subsequently, we re-audited and we found that the quality of the discharge letters had significantly improved. And the GPs were much more happy with the quality of the discharge letters. We've embedded the training for junior doctors into the induction program, so now it's standard part of their ED experience to know that the letters need to be of high quality. This has been a success for EDSIT, and we now have presented this information at a number of forums. The second project we looked at was blood hemolysis. Sometimes blood test results come back as hemolyzed, which means that we don't then have the test results. From the patient's perspective, this means delays, and from the Trust's and department's perspective, it means additional costs. These tests have to be then repeated. This is inconvenient for the patient and so therefore a potential poor patient experience. It also means that the patient may have to have a short stay admission, either in the emergency department's CDU or on the ward. We have been auditing the numbers of tests that have been hemolyzed, and with this information that's soon to be ready, we will be able to liaise with other departments, particularly with the lab. So we will understand what the problems might be and how we may work differently to reduce the rate of blood hemolysis. The positive spin-off is a patient experience benefit and also reduced costs. In EDSIT, we've also worked with acute medicine to develop the ambulatory scorecard. Now this is an assessment tool for medical patients potentially requiring admission. The benefit of the ambulatory scorecard when it's seen to work is that some patients can be discharged to medical clinic follow-up instead of having an inpatient stay. This has a whole range of patient benefits and reduced rate of bed occupancy. Another important project undertaken by EDSIT is the provision of analgesia in the emergency department. providing analgesia is one of the core functions of the department. And when we audited this, we found that many patients did not get early or appropriate analgesia, and of those patients who did, many of them did not have a timely reassessment. There are national and departmental standards for the provision of analgesia in emergency departments. So we've used these standards and we've introduced training for frontline staff in triage. We've explained the importance of early effective assessment and provision of analgesia. And we've produced a aid memoir for the provision of analgesia. A future innovation will be the introduction of a phone app which will prompt the assessment and provision of analgesia and also prompt the reassessment of analgesia. This work also has been presented and published in various meetings. In the future, we hope to look at other patient experience, quality of care and cost reduction projects. Some of those include looking at frequent attenders to the emergency department, an important patient group. Also looking at the assessment of patients who present with dizziness. This is a common presentation and can have a wide range of different causes, some of them quite serious, including, for example, stroke. With the right pathway development, some of these patients can be imaged and followed up on an outpatient basis instead of having to be admitted if the right patients see the patient early on and if there's a clear pathway to follow. So this is another innovation we're quite excited about. With all this work going on with EDSIT, what's very important is to explain to people outside of the emergency department what achievements have been made. It also conveys the message to others that service improvement within a very dynamic and pressurized environment such as the emergency department is possible, especially when run by a committee made up of people from within the department. So to this aim, we have presented at GP meetings on the discharge letter success. We've presented at the BMA Agents for Change conference on the administration of effective analgesia. And in the autumn, we are going to be giving oral presentations on service improvement in emergency departments and also on the induction program to educate junior doctors on the importance of good quality follow-up information. We also aim to present the success of EDSIT at a number of other meetings in the future. I think the key message here is that even in such a demanding environment as a busy emergency department, if the right people are involved in a committee that's very interested in service improvement and lean approaches, real change can be made. And this change can be in terms of governance and safety, patient experience, and reducing cost. But also it's really important for the morale of a department to know that the individual members of the department have an opportunity to affect change in their own working environments and for the patients they care for. Thank you.